personal competence, records and reports. Now, what are the different methodologies which are involved, or what are the different components which are involved in internal audit? What are the various processes, or what are the various approaches you should use while performing the internal audit? It should not be based on solely observations. It should not be based on solely on oral communications, and it should also not be based on solely review of documentation. So it should be a combination of your observations. It should be combinations of reviewing the documents. It should be observations of competency and interviewing of the staff as well as the personnel who are working in the laboratory. It should be observations and examinations of the records. It should be examinations of the review of the environmental conditions, equipments, procedures. So all together will comply a internal audit. So you should use various approaches and combination of these approaches to conduct an internal audit. Effective internal audit will identify the problems and weak points in the system and suggest remedial measures. So internal audit is not only finding the problems, finding the faults. You should have that positive approach where you are going to identify gaps in the processes, deviations from the processes, and you should be able to suggest remedial measures. So we have seen many a times when there is an audit or an assessment, many a times we face such assessments and audits where the auditors or assessors may raise certain gaps or may raise certain non-compliances, but you have to see they should be able to suggest you remedial measures also. It is a part of an internal audit that not only finding the gaps or identifying the problems, but they should also suggest remedial measures to rectify those issues or to have appropriate corrective actions with respect to the audit findings. Laboratory shall conduct one complete cycle of internal audit at least once in a 12 months. So you should cover each and every activity of the laboratory, each and every areas, each and every sections, each and every strata of your laboratory at least once in a 12 months. So at least one internal audit you have to conduct in a year. It is a minimal criteria. You can also opt more than one internal audit. So basically when it is required, when you have newly implemented any management system, whenever you have newly implemented any guidelines, whenever you have newly implemented any new areas, certain new tests if you have included in your laboratory work processes, so you may require an additional audits, or we call it as a focused audit. So those audit will be based on particularly on those areas or on those aspects only. So you may have more than one internal audit whenever you want to have assurance about the implementation of all the activities and all the procedures in your laboratory. As far as these guidelines concerned, it mentions that at least one internal audit should be conducted once in a 12 month. Okay. Internal audit should be done by a person who has been trained as an auditor. So those persons who are trained as an auditor. So there are specific guidelines for to become an auditor. So there are guidelines for auditing a management system as per ISO 19011. So your auditors are auditors who are conducting the internal audit of the laboratories. They should be trained as per those guidelines of. They should be well aware of the auditing techniques, auditing methodologies. They should be well aware about the guidelines, protocols, routine workflow of the laboratory. They should have competence and technical knowledge. Apart from that, they should have access or they should be authorized to perform the internal audit of the laboratory. So all these aspects must be considered while selecting an internal auditor of a laboratory. It is recommended that all internal auditors undergo 4-day standard and internal audit training program. So there are various training programs. You might be seeing all over going everywhere. So it is recommended that your internal auditors who are performing the audits of your laboratory, they should have undergone a 4 days training program for the standard, whichever standards they want to audit, and the internal auditor program. So a combined 4 days training program must be attended or must be completed successfully by this personnel whom we are going to choose as an internal auditor. A technical audit checklist needs to be maintained by each laboratory. So there should be predefined criteria. As I have mentioned initially, there should be defined criteria for performing the audit. For that, you should have specific checklist. What you are going to see, what you are going to examine, what you are going to observe, which activities are going to be get audited. So you should have specific technical audit checklist which is to be maintained by each laboratory. So here in Annexure 7, it is given. So I will have a brief discussion on this audit checklist also. A model technical audit checklist is provided in Annexure 7, which needs to be maintained by each laboratory. So it is a model technical audit checklist. So a ideal checklist, how an ideal checklist should be there. It is given in Annexure 7. So these minimum criteria should be available in your auditing checklist. You can have more than this. Apart from this, any other additional criteria which are relevant for the auditing of your laboratory activity. Laboratories may adopt this to make it more comprehensive and relevant. So it is recommended that laboratories can adopt this checklist, which will provide a more comprehensive and relevant checklist with respect to the auditing of the laboratories. So here is a Annexure 7, basically, which is a technical audit checklist. So what are the component of this audit checklist? SOPs should be there. SOPs should be audited. SOPs, as I have mentioned, standard operating procedures, how to prepare the SOPs, how the SOPs should be written in detail. We have already seen in the previous class. Then your IQC data, that is precision statistics. IQCs are used for the purpose of monitoring the precision in your laboratory results. So the statistics related with the IQC data should be audited. LJ charts should be audited or examined. Equa data or proficiency testing should be audited. So Equa data, LJ chart, IQC data, these are all the key components of your technical checklist which will focus on your reliability of the results generated by the laboratory. Corrective actions which are taken in case of QC or Equa outliers, sample handling, identifications and storage. These areas also should be audited. Now sample handling, identification and storage, this can be audited by observations, by interviewing questions, or making appropriate activities in your laboratory. These areas can be sufficiently audited. Then measurement traceability, you should have traceability, calibration traceabilities of your reagents or other materials which you are using in your laboratory. Those should have appropriate traceabilities. Then equipments also must be audited. Maintenance of the equipment, preventive maintenance of the equipment. Maintenance will be of two types. One is the preventive maintenance and one is the breakdown maintenance. So what was the turnaround time for breakdown maintenance? How much hours or how much time the equipment was down? What are the alternative arrangements the laboratory has performed during those maintenance procedures? That also you have to check. Then you have to also check appropriate calibrations. Now, who is going to calibrate the equipment? So appropriate authorized laboratories should participate in calibrations of the equipment. They must be have appropriate accreditations, or they also must be following appropriate standard for calibration. So that also you have to include in your internal auditing. And finally, data on uncertainty of measurement. So what are the uncertainties? What are the allowable deviations in your results? Those data also must be examined during your internal audit. So this is a model checklist which is included here in this document. You can have many more additions, many more areas, activities can be included as a part of checklist here, provided it is relevant and it is going to help you in examining the procedures of your laboratories or compliance of your laboratory. So coming to the next part of this session, today's session is the risk management. So again, this is one of the very important and upcoming topics in the laboratory. Now, you might have heard this risk management at various places during various trainings. You might have seen various literatures. If you have faced any assessments or audits, there also they might have emphasis on risk management. So, how it has come suddenly, or how it has come suddenly in our medical laboratories? Is it something like that? Something newly has been added into your laboratory protocols, in your laboratory standards? So basically, risk management in medical laboratories was introduced long back in 2003, and thereafter continuously it was there in all the activities of the laboratories. The only thing which was not there was we were not aware about the risk management protocols and risk management concept in the laboratory. So now, with more awareness, these risk management strategies are appropriately implemented in most of the laboratories. So, what are these protocols? We are going to see this topic here in a very short. So, basically, risk is a combination of the probability of occurrence of harm and the severity of that harm. So, here you can see this definition has two dimensions. One is the probability of occurrence of the harm, and the second dimension is the severity of those harm. So what can be the probability that a harm can occur? And the second part is how serious or how severe that harm will be. So the combination of these two is called as a risk. So this definition is given in the ISO IC guide 51. So apart from these two, sometimes we add one more dimension to do this risk combinations. So apart from the probability of occurrence and severity of the harm, we also add many times the detectability of those harm. So how frequently or what are the chances that the harm can be detected in advance. So this is a three-dimensional definition of risk in your laboratory. So basically hazards are all the potential sources of harm. Hazards are the potential sources. Here we are talking about the potential sources of the harm. What is a harm? Harm is any physical injury or damage to the health of people. So basically, we are talking about the health of the people. So these peoples are basically your patients. It can be your staff who are working in the laboratories, or maybe any other personnel who are visiting the laboratory in your for your laboratory for any other purpose. So hazard is a potential source of harm. Harm is the physical injury or damage to the health of the people, and severity is measure of the possible consequences of hazard. Possible consequences, severity of those consequences, severity of those harm. It will determine by the severity of those hazards or those harms which are caused due to a inappropriate procedure. So coming to the definition of risk management, the laboratory shall evaluate the impact of work processes and potential failure. Here we are talking about not failures, we are talking about potential failures on examination results as they affect patient safety, and shall modify processes to reduce or eliminate the identified risk and document decisions and action taken. So risk management is basically a complete complex where we have to evaluate the work processes, we have to also evaluate the potential failures in examination results and their effect on patient safety. After evaluating their effect on patient safety, we should be able to modify these processes to reduce or to completely eliminate these harms, and finally the documentation of whatever actions and decisions we have taken with respect to handling of this risk. So risk management includes right from evaluation of the impact of work processes and potential failures on examination results, their effect on patient safety, and modifications, that is the appropriate risk management or risk elimination of this identified risk, and finally the documentation of the actions and decisions which are taken during this risk management. Risk management process. Next concept here is in the risk management is the risk management process. Laboratory should create a process map that outlines all the test steps of the testing process from physician order to the reporting of the results wherever possible. Now, many a times I get questions how to perform the risk management, how to assess the risk. So to assess the risk in your laboratory, first of all, you should have a detailed knowledge of all the processes in your laboratories and each step, each procedure which is involved in those processes. So you should know components of the processes in your laboratory. You should have a complete map from where the actual process starts. So the laboratory processes basically starts right from the clinician order raising a request, whether the request is raised appropriately, whether the samples are appropriately collected, whether the billing is done appropriately, whether the procedure of sample collection was appropriate, whether there was appropriate patient identification, then sample transportation, what are the factors which will affect the sample transportation, what are the factors which will affect the sample collection, then preparation of the samples, what are the factors which will affect the preparation of the samples. So you should have a complete map of your laboratory processes right from the physician order to the reporting of the result. So once you have map of these all processes, you will be able to identify where can be the potential hazard, where can be the potential risk, where can be there are chances of something going wrong. So you have to point out. So a simple process, take a blank paper, A4 sheet blank paper, and start writing whatever comes in your mind right from the physician order to the reporting of the result. Whatever comes in your mind with respect to process which are carried out in the laboratory. Whatever comes in your mind, write them in a specific order from top to bottom and identify the areas where there are chances of error. So, for example, if I start mapping out everything and I am finding out one place very critical, identification of the patient. If something goes wrong, if the patient is not identified appropriately, then there are chances of mislabeling, chances of misidentification, which is going to affect all the other processes in your laboratories. And finally, a wrong report is going to the patient, which will either deny the treatment or the patient may be wrongly treated. So this is the process of identifying the risk in your laboratory. So here this is a risk management process. Map is there. You can see this map, and this map is adopted from CLSI EP30A guidelines 2011 volume 13. So this is a very old document, but the basic risk management process map remains the same. So what you have to do? So here you can see there are two major components. This one big rectangle and the aspect or the things which are outside this rectangle. So we start from the risk assessment. Once the risk is assessed, you have to identify the severity. So once the hazard is identified, you have to see the severity of the harm, like how serious it will be, whether it is possible to have any serious complications or serious damages, that you have to see. You have to also see the probability of harm, whether it will occur or not. So when there is a sample collection, patient identification, the severity can be very severe. The patient may even die because of wrong patient identification. But you have to also check what is the probability. How many times you are doing this misidentification of the patient? Daily, one patient, weekly, one patient, monthly, one patient, or yearly, one patient. So you have to categorize probability of this harm. And finally, you have to estimate the risk. You have to evaluate the risk, whether this risk is acceptable or it is not acceptable at all. Like now we know the severity of identification of the patient if misidentified is severe or catastrophic. But the probability, you have barcode stickers, you have appropriate patient identification, you have patient tags, all the things are in place, everything is followed appropriately. And in a year, not a single patient have been misidentified. That means the risk which is evaluated is negligible. The risk after evaluation, you come to conclusion that because there is no probability of risk misidentification, even though consequences of misidentification will be severe, catastrophic, but Due to all the measures or whatever all the protocols available in your laboratory, there is a very remote chance or a negligible chance or no chance at all to happen this process. So finally, the risk evaluation will comes to zero. So if it is within acceptable limit, you may have to plan some additional risk control measures and you have to monitor if there are chances that this risk can cause severe impact and also the probability of harm is also more, then it will be categorized as moderate to severe risk. You have to control the risk, you have to implement certain actions, you have to put certain protocols, double checking of the patient, positive identification of the patient, minimum two identification of the patient. So like that you have to put risk control measures in place. Then you have to monitor those activities, whether after putting all these things in place, whether now there are any chances for patient misidentification. So you have to keep a monitoring. And if there are any new chances or if there are chances of any new hazard or if the severity has changed or if the frequency has changed, you have to investigate it appropriately and again you have to start the complete cycle. So first part is hazard identification, severity of the harm, probability of the harm, risk estimation, valuation of the risk, control measures, monitoring of control measures, continuous monitoring and investigations of new hazards or investigations of process in right from the beginning or as a part of routine monitoring processes. So this is a complete risk management process which can be utilized or can be implemented in your laboratory. Now the last part of today's session is quality indicators. So it is essential for the laboratory to establish quality indicators towards monitoring and evaluating the performance throughout the critical aspects of pre-examination, examination and post-examination. So you should have indicators which will help you to monitor and evaluate the performance of your laboratory. So basically evaluation of the laboratory performance based on two different criteria or two different techniques are available basically for evaluating the performance of the your laboratory. One is the continuous monitoring of performance with the help of quality indicator and one is the periodic monitoring of the performance of the laboratory with the help of internal audit. So internal audit also monitor the performance of your laboratory and quality indicator also monitor the performance of your laboratory. The only difference is quality indicator monitors it continuously in a real time, whereas internal audit monitors the performance of your laboratory on periodic basis. So you should establish appropriate quality indicators in pre-examination and examination and post-examination processes. You should also know the purpose of quality indicator. What is the purpose of quality indicator? Give information about the performance. So when you define an appropriate quality indicator, you must know what are the objectives of monitoring this quality indicator. Now many times I have seen when you go and when you see the quality indicator of some laboratories, for example, number of rejection sample in the laboratory. So the lab is having a beautiful Excel sheet and they will be plotting beautiful graph. Now what are the data they have collected? What are the data they have collected? But when you observe that data, you will see that number of rejected sample. On first day 0, second day 0, third day 0, fourth day 0, fifth day it is 0. So likewise, throughout the year, throughout all the 365 days, the laboratory has not even rejected a single sample. Then what is the objective of monitoring that indicator in your laboratory? Is it going to give you any feedback regarding the improvement process? You have already achieved all the targets. Your quality indicator is almost 100% perfect. You have set a target of 0 rejection samples and you have already achieved it on a continuous basis. 365 days, there was not a single rejection of the sample. So basically, there is no purpose of monitoring such quality indicators because it is not going to give you any feedback regarding the improvement activities. So you have to define appropriate quality indicator where there should be appropriate objective behind that quality indicator. Then you should have specific methodology of capturing the data, how you are going to monitor, how you are going to capture the data, how you are going to represent the data with the help of graph, with the help of statistics, how you are going to analyze that data, What are your limitations? Limitations means, for example, there is a quality indicator turnaround time. So I am monitoring turnaround time for my glucose results, and I have fixed a turnaround time of 5 hours. So now 5 hours I have achieved 100% of the report I am able to give within 5 hours. Then to going for the next step or to have more improvement to quality, I have reduced it to 3 hours. So okay, after a few months or after a period of 6 months, I have achieved the turnaround time of 3 hours also. I want to go one step ahead. So I have now put my target turnaround time as 1 hour. So after a lot of hard work and lot of trainings and evaluations and monitoring, I was able to achieve that even that 1 hour also. So now my turnaround time, I have achieved that all the results are getting released within 1 hour. Now I have something which is unrealistic. I want to release all the glucose results within half an hour, within 15 minutes. It is not possible. So now you have to set a limit. You cannot go beyond something. This is the limit. So you should set the limits of your quality indicator. You should also have appropriate action plan where you are not able to achieve the targets in your quality indicator. Like in the first, initially I have mentioned that 5 hours for glucose result reporting. If I am not able to release within 5 hours, then what is going wrong? I should have appropriate action plan. So you should have appropriate objective, methodologies for data collection. You should have appropriate representation of the data. You should have appropriate statistical analysis of the data. There should be appropriate limits for your quality indicator, and then you should also have appropriate action plan when you are not able to achieve those quality indicators. It is not only just making some calculations and noting down some data on daily basis. There should be some outcome from those data that will help you for improving the performance of your laboratory. The quality indicators must highlight potential quality concerns. So it should highlight potential quality in the concerns. What are the quality concerns are there? It should be able to find out those quality concerns in your laboratory processes. Identify the areas that need further study and investigation. So if your all data says you have achieved all the data and all the indicators to the benchmark to the 100%, that means it is your quality indicator plan is not able to identify such gaps. So your quality indicator plans must be able to identify such gaps, which will help you for further study and investigations. You should be able to track changes over a period of time. What is your progress? What are the targets you have achieved? How many targets you have achieved? All those should be included, and your quality indicator should be able to monitor all those data. What are the characteristics of a good quality indicator? It must be measurable. So you should monitor only those things which you will be able to measure. It should be a measurable quantity, or it should be a measurable process. It should be achievable. As I have mentioned, turnaround time less than half an hour is not achievable. So you should fix a quality indicator and quality benchmark which are achievable, actionable, where you can take appropriate actions if something goes wrong. It must be balanced. You should not also expect anything which is unrealistic, and timed. Within a stipulated time period, you should complete those quality indicators. You should complete those benchmarks. You should achieve your targets with respect to the quality indicator. It is not like that you have fixed some quality indicator and since last 10 years you are trying to achieve it, and you are still not able to achieve that is, so it doesn't carry any useful outcome. So it should be timed. Examples of quality indicators. So here we have included some examples of quality indicator from pre-examination stages, like specimen containing labeling errors, specimens rejected, specimens without mandatory history, specimens received beyond stability period, specimens quantity inadequate, specimens levels and TRF details not matching. So these are some of the quality indicators in pre-examination area. In examination area, your improvement in percent CV of analysis over 12 months period, improvement in your PC preventive proficiency testing performance, equipment downtime, kit non-availability, trainings conducted. These are some of the quality indicators in your examination areas. In post-examination areas, inpatient laboratory results availability, That is percent of the test results available for morning rounds as stipulated in the institutional policies. Critical values reporting in defined time. Critical values to be reported in a defined time. It is not like that something critical result is there and you are informing it after 2 hours or after 1 hour. As soon as the result is ready, you should be able to inform it within 5 minutes or within maximum 10 minutes so that appropriate actions can be taken and appropriate decisions can be taken. Turnaround time achieved by defined clinicians or customer satisfaction with the laboratory services. So these are certain examples of quality indicator in post-examination areas. Also, complaints, number of complaints, critical complaints, time taken to resolve those complaints, these also can act as a quality indicators with respect to your operational processes. So you have to select quality indicators as per your requirement, which will help you in your improvement activities. Laboratory can define indicators beyond these also, example, number of fill, cost per reportable test, productivity per technicians. So all these are miscellaneous quality indicators which also help your institute to appropriate manpower planning or appropriate financial planning of your institution. So those also can be included as a part of quality indicators. So with this, we are able to complete this today's session on time because we have an additional session with respect to the scientific sessions from Mindray also today. So before starting, we will just take a quick question which are available in the Q&A box. What is the role of biomedical engineer for laboratory equipment? So maintenance of the equipment, calibration of the equipment, certain minor or major breakdown maintenance should be taken care by the biomedical engineer in the laboratory. What type of certifications for auditor I have mentioned? There should be a 4 days training program which should be carried out, for which the auditor should be trained as a part of internal auditing. So they should be trained in the standard itself. So standard for medical laboratories ISO 15189 2022 and the certification for internal auditing is as per ISO 19011. So they should have completed all these trainings with respect to the internal auditing. Biochemistry section in charge, audit hematology, sir, we trained in-house. Okay, participate. Yes, it is absolutely acceptable. Please, can you explain with the example about measurement uncertainty? So measurement uncertainty, we have actually covered this topic in our internal quality control. Measurement uncertainty is basically 2 into CV percentage. Okay, so it is a very simple calculation for monitoring of the laboratory. You can go into much details. There are various sessions on that. Basically, we will not be able to cover all those part here. But if we have time permit, we will take it tomorrow because tomorrow we have last session. So this measurement uncertainty, we will dedicate 5 minutes of time when we are going to consider this measurement uncertainty. Okay. Enable ask precision check in test parameter we will show internal QCs. Okay, we run 20 samples of run test parameters. Yes, that is fine. No problem. You can perform those precision checks with the help of 20 samples. Measurement traceability, again, as I have mentioned, if time permits, we will take the details on this on tomorrow. Internal audit checklist, we have given a model already in this program. We have included. You can include as much as points which are mandatory or which are essential or which you feel relevant for the internal auditing of your laboratory. Failure mode effect analysis is compulsory for risk assessment. You have to perform a risk assessment. For that purpose, there are various techniques and various methodologies. Failure mode effect analysis is one of the techniques. So you can use it or you can use any other technique for risk assessment. It is not mandatory to use only failure mode effect analysis. You can have multiple techniques and multiple procedures for risk assessment. Okay. Apart from the test, pre to post evaluation request processing IQC reporting, what other general risk can be a part of risk assessment checklist? So equipment you can use, appointment of new manpower, appointment of a new personnel, trainees working in the laboratory. You can also check risk associated with your infrastructure, that also can be included as a part of risk assessment in your checklist. Risk analysis among the staff safety include in risk analysis not or not? Yes, it is included in the risk analysis as I have now itself I have mentioned. Hi, can you send the list of documents in the audit? We have already included the sample checklist here. As I have mentioned, it includes all the aspect of your technical checklist. You can have more elaborate checklist. You can have a detailed look into other checklists which are available for making a comprehensive checklist of your laboratory. Number of parameters tested for such a long time without any revision may also indicate that not enough attention has been paid to look into this result. Details of the data, entire error will be increasing to look at it. Okay, very good. Of the input. How to do gap analysis, how to find gaps. How to find gaps means you have to see what are the standard practices and what you are doing. Simple example, centrifugation should be done for 10 minutes. You have to see how many minutes you are spending. It is done for 10 minutes or you are finishing it within 8 minutes or 5 minutes. That is how each and every activities, what is the standard guidelines and what is being followed in the laboratory. You have to monitor, that is called as gap analysis, where I can get certification of audit is as I want to do it. So there are a lot of trainings available online or offline programs are available. You can get certification from that. Can we get any certificate of participation? Yes, it will be provided tomorrow after completing all the pre-assessment and post-assessment and after attending all the training program. So can we share your actions on hemolysis in pediatric cases? See, if there are hemolysis, that means there is something wrong technique is being used in collection of the samples, whether it is a pediatric or whether it is a adult sample. If the technique is not used appropriately, you will get the chances or you will have the hemolyzed sample. So appropriate sampling techniques and sampling protocols must be followed. There are some various different and specific protocols for pediatric sample collection. You need to follow that so that there will be no hemolytic samples. One quality indicator is enough for laboratory to cover all the sections. Is it possible with the help of one quality indicator, you will be able to collect all the data? No, it is not possible. Should we train all technicians in ISO 1581? No, no, absolutely not required. But yes, GCLP training is mandatory for all the staff and all the personnel working in the laboratory. Okay, ISO 15189 may not be required, but GCLP training is mandatory. How do we vendor evaluation? Vendor evaluation you can do. You have to see what are the supplies we given by the vendors, how much time they want to supply, what are the amounts or what are the number of items they can supply to your laboratory, how far, how soon they can supply, what is the quality of the product, what is their pricing, what is their turnaround time. You can evaluate on various criteria your vendors. 12 months CV percentage will calculated how much it should vary from each month. So basically you for that you can look into CLIA guidelines 2024 for acceptable CV percentage. Those have been published recently a couple of months back. Sir, what is in-house IQC material? It is basically pooled patient sera. You can use it as an in-house IQC material. Also in other interferences, LIPA and ICTROS. Yes. Please demonstrate risk assessment and with an example. So due to short of time, we are not able to cover all these topic in detail, but I have given a very simple example. Don't try to use any or don't go into those half-hat terminologies of FEMA or something on fishbowl diagram and brainstorming. These are very simple techniques for risk assessment. As I have mentioned, take a blank paper, write down what are the activities we are performing in the laboratories, find out which are the activities where the errors can happen. Also find out which are the activities which you should prioritize, which are more important, which are more critical, and take actions. It is not mandatory to use any hi-fi techniques or hi-fi terminologies while performing the risk assessment. Do we fix lab mean for hematology controls? I have already mentioned there is no need because the law changes very frequently. Is it mandatory to do method validation on the frequency with changes? I think you have missed the previous classes. We are not going to do any method validations in our laboratory. We are only performing method verifications in our laboratory. How much data is sufficient for proper lab mean new lot of QC? At least 20 samples should be used for lab mean setting. Okay. So please fill the feedback on how much percent CV is considered for IQ. So as I have mentioned, please follow CLIA 2024 guidelines which have been recently published couple of months back for acceptable CV percentage. Acceptable CV percentage, again, as I have mentioned, it is freely available. Clear 2024 guidelines are freely available. You can download it. What is the number of sample to do precision? Also, this also we have discussed in the 2 days back in the topic that 20 samples are required for precision and 2 samples in duplicate at 2 different levels are required for accuracy. How to use Six Sigma as risk management? Oh my God, this itself will take a complete session of 8 hours. So we have kept it very short, and I have given you the basic idea. As I have already mentioned, don't go into those high-fi techniques and terminologies which are given various in publications or somebody who is talking in their talk. Keep it simple, and the intent should be clear that no harm should be caused to the patient. Avoid all type of harm to the patient. Intent should be clear rather than the techniques or methodologies which are used for the risk assessment and risk management. What is uncertainty? Yes, as I have mentioned, if time permits, we will take this topic tomorrow. Within 5 to 10 minutes, I will be able to post it. The post test link will be posted tomorrow because still we have one session remaining tomorrow. So we will do it tomorrow. So now I hand over to Nikhil. Whoever is from your side can take the technical presentation or scientific session for today. Please continue.
Yes, sir. Yes, sir. Thank you very much, sir. Thank you very much for your extensive session covering important topics like, internal audits and, technical checklist, and then, of course, the risk management. Thank you very much. And the audience really enjoyed with so many FAQs we are getting so many. Thank you so much. So now we move on to the next session. So please hold on. Next session is, it talks about why should we standardize our laboratory, why we should establish protocols. And the second topic is how do we build a standardized laboratory? So it's a very interesting topic. You will really like it. And the next speaker for today is Mr. C.R. Bala Venkat from Mindray India. So just to give you a brief about Mr. Bala Venkat, he has more than 24 years of experience in IVD industry. He is actually working with Mindray India for more than 13 years now. And of course, he has 10 plus years of experience as an IVD support manager and is currently heading our strategic key account service. And so, yeah, and he's actually, just to give you a brief, he is leading our Mindray standardized laboratory project since 2021. So it's great to have you, Mr. Bala, here. May I request you to please share your Bala, you want me to share the PPT or you'll do it? You are on mute, Bala. I'll share your PPT. Bala, can you unmute yourself?
Yeah, you can share the PPT.
Yeah, right away.
Yeah. Good evening, delegates. I hope you have enjoyed the last 7 days of fantastic academic section by Dr. Jayesh Warade. I think I really am very confident that you had gained lots of practical knowledge. We are really thankful to Doctor for coming up on this platform and giving this informative talk and supporting the IVD community. I have seen this topics on today are risk management and quality control. So this is one of the most important thing in our lab standardization. So why we want this kind of lab standardization. So before I get in, I'll just want to share that this only like the way how we practice in laboratory, though it is a small lab or big lab, the report's quality has to be maintained and safety of our technicians or the patients should be utmost. So for that reason, maybe this section will be a little more adding to the point of this, today's discussion. I'll straight away go with this presentation. So this, why we want to establish a standardized laboratory. This is one thing everyone will really look at how I'm going to develop my lab and how my lab has to be like how it can be recognized by the customer, like the patients or customers or externals. So this is that can become a referral for them for the quality of reports. So what we have to do in this, next slide, please. So this is the requirements of the external driving force for a lab development. So you can see a lot of policies, regulations, financial support, patients' confidence. So these all are required, and standard and driving. So this is a conductive path for pursuing labs for the development. So this is one thing you can see. You can look at the ISO, what and the infrastructures, which are all required for the laboratory. The next slide. So this is a major important force which is going to have. And this internal driving force for lab development, you can see how we want to develop the lab, because we need more samples, more revenue, or it's a quality outputs. So how to manage? So our development will be depending on our quality reports, the trust which we get from the customers. So that development is like it can be from small to medium, medium to high. This workload can increase with our practice, good practices. So that way we have a pattern how we can grow from 2014 like a year on year, how we can travel. So this is the pattern which we suggest, or we just have that the model platform how the lab can develop by the budgets what they have with the quality consciousness. Next. So these are the few things where small labs can fall to medium, what they encounter. You can see we have different kind of laboratory requirements are there, like, for this, like public laboratories, private, then laboratory staffs. You can see for the public laboratory, you can see upgrade to a higher level. So this is one thing, and expand professional influence, communicate with peers lab. This is one more important. So we have to get more peer groups so that we reduce the cost, get a economical quality reports for the patients. So these kind of things are our basic requirements. So both, though it is both public or private. So these are the demands which we have to see, and for which we want to have a better process. So this is our lab standardization. What do you mean by that? It's a complete experience which we are going to give for a patient. So when they come in, one big factor which we consider here is the safety. So one of the main thing, when patient comes in, he should know which area he is moving in the lab, and whether he is safe enough, there is no contamination. So whether it is the right way he is going. So he should have a clear direction. Similarly, the lab staff, they should also know how they have to work in an organized way, so that that time can improve. This is one of the topic for today's discussion from the doctor, where we want to improve the TAT, how we can improve the ergonomics movement inside the lab, the way it is processed. So these things will really improve uh, uh, the, the timeliness, how they complete it with the effective way. That way, thereby you can achieve the TAT. So for this, we can, in Mindray standardization laboratory, we can see standardized quality control, then standardized report results, then standardized safety operation, then testing process and management. So this is the ultimate level which we are focusing on our lab standardization. So we can, next slide, please. Yeah. This is what we build, and how we build a standardized laboratory. Everybody will be more curious what is the process involved, and how we can completely transform a lab to the standards with what we require. You can next page. Yeah, next page. Yeah. So this is first is the service delivery, because instruments should be up always. So the escalation process, the reachability, everything should be in a easy way. The customer should be knowing whom we are dealing. So first our partner should be known, and we should be having a easy first contact interface. We should develop that kind of that relationship. So that's the reason Mindray India, if you see, we have call center services. We have 4 branches, and Mindray 30 service engineers are available, and we have authorized service channel of 100 plus. So this, we have that alignment for our customers. So align with our customers. This is our main core values, with which we have started doing well. And this is our lean management, where we can see the IVD solution. We talk about 4 parts in our lab standardization. One is the basic service delivery. Second, smooth process, lab promotion, and lean management. Here, if you can see basic deliveries, you can see Mindray active visits. We can identify. First, we need to do the audit, how the things are going, what is the process they are doing, understand, and we can see whether we can simplify it. So those, and for the instant support, like for the breakdowns or the application support, like for any new parameter support, all this instant support also should be developed for them. This is our basic delivery section. Second thing is the smooth process, where Mindray will be Mindray visible services we have to see, and workflow optimization for how we can get to the samples, so that when the TAT is improved, the flow of samples also will increase because of the fastest report delivery. So this is one thing. And lab promotion, we do support NABL, NABH, and also excellent courses are also available with Mindray. So we have an academy where we can where it can be participated, and we can receive that courses. And fourth is the lean management, where we will be making the lab to the level of the expected standards. Next please. So we would like to consider one example so that what we are discussing can be clearly explained. We can see this Neogen lab is one of the customer where we selected, and we wanted to develop one standardized laboratory for the Chennai. It's in South. The background is they have biochemistry, hematology, and immunology equipments, with which we started because it's like a hub for Mindray. So we started to elevate the customer's value. So what we did, we can next page please. So we carried out our basic deliveries. So we inspected. So we have initially we aligned our channel partner, who is our channel partner, whether they are delegating all the operations, fast response or good. So we have ensured that. Then what is that we can do for our customers, because they believed and they have purchased Mindray equipment. So what is that we can provide? So this is what we try to do: more effective supports, value-added services, and familiar with the Mindray. So this is what we are discussing. In value added, we have brought in this lab standardization, and also we have different training programs for the end users, for the biomedical team who is handling, so that also the quality people, quality team, we all give training to ensure that the lab runs in a very smooth way. Yeah, next slide, please. Smooth process. So for this next page, yeah, this is how we can do it. So we want to study the process. So workflow optimization was being done. So we observed all the area, how it was, and then we had provided them the solution. It is not that we just arrange it. It is arranging according to the department wise, what internally they are doing it, how the sample can be moved in, what is the minimum way of doing the sample movements. So for that, I have shown you the workflow before and after, how the lab has been arranged neatly. Earlier, the waste bins were also not well aligned. They were a little confused. So this is the way where it was little chaotic, and you can see the picture where we have little bit done, and more I can show you in coming slides. So to with this smooth process, we have to do an audit. We have to see what is the status of the lab. So we have started from the reception to the end of the process, even till the storerooms, how they maintain the stock. So we have completely this process. We work with the customer and understand the problem, and you can see how the reception and the entrance of the laboratory has completely changed. You can see we are clearly defining the rooms. Earlier it was only just a restricted area. We have made it is a clinical laboratory. That is then we say it's a biohazard. So those kind of uh, uh, indicators has been mentioned, so that it will be easy. And you can see the glass doors also. So little bit of what to say, like a quality appearance for the customers, that also we have provided to them. So next, then this is our hospital logos. As you can see, wherever it is, it was not properly mentioned. So for behind each machine, we have isolated the machines based on the departments. You can see that department allocation was being done, and we have provided them the list of tests being run in that laboratory by the instrument. So in that instrument, so we have given behind. You can see the boards even that we have designed for them. Next, please. And you can see the draws, how they are maintaining it, little chaotic. Even they want to take any scissors, they have to search. So here, everything, even the draws and the tray, sample trays are well aligned for their convenience. Next. So a complete rearrangement is being done. You can see the reception area where we have clearly aligned as per their need. There are a lot of issues were there in the ergonomics. They cannot sit properly, so we have to arrange a separate table for that kind for them, for the reception people to sit and do in a very comfortable way. So this is one thing we did. So this is the reporting area. Yeah, you can go ahead. Next. And this is the equipment, because a small equipments and all, on and off, they try to move it according to the convenience. They just move it and write it, because it is not wise to move the machines that way. We do not know how much pressure or how much force we give it to it. So we give that kind of like a box, like that is the area in which it has to be kept, to just be placed. So we indicate. So those kind of things, you can see yellow kind of borders for each machine with a proper spacing. So this gives that good space behind ventilation. And not only that, each and every cable is routed well, tubings are routed well, so that no congestion or jamming or behind for the cables. So it will be an easy process for them. And even you can see the pins which has been aligned easily for them. So if they move it, they know that it has to be kept in that position. So this is one thing which will give them. And you can see we have also the last fourth picture. You can see a lady working. So that portion, it's like a working table. So we don't want to bring any samples into it. So we completely marked it like a section. So where samples cannot come into it. So it has to go. It should not be any part of it. So it is only a clean table. So it will be marked in green color. So we have the three type of tapes which we are using. One is white, yellow, green, and red. Four tapes for the tables. So which will give an indicator. Green, it's clean area. White tape, we say that it unused things can be kept, like papers, any telephones, those kind of things. You can keep it in that section, so that you can say it is clean. And we have red mark, so where you can say it is a little bit contaminated area. So yeah, the other one. And you can see this is how we inspected, measured, and then we aligned the machines according to the process. So we initiated the samples. Then we have this sample area also, made it very easy for that. Made one divider for the sample to come from sample area to the laboratory. So we made it very simple for them, rather taking it, traveling it to the other place. Next slide. And out of this, now this is important one for the refrigerator, how we have to maintain, because we have a practice that we keep the reagents with biochemistry, everything separate. But what further we can do is we can have used kits separately, and more often used kits in the top and very rarely used at the bottom. So that will give easy uh, like fast selection for the user, so that they can easily take the things from the top rather bending and searching. So we even label each uh, uh, racks by what it is, like as a biochemistry or hemat used or unused, controls, calibrators. We clearly give a label to that. Next one. Not only this, we also do the tables. Even all the tables are marked with what is inside. So even the tables are clearly defined. Whoever comes into the lab without any knowledge, any auditor comes, he can rightly pick the records from, or the document, whatever it needs. So it will be clear, crystal clear, patient data, open, and you can take. So everything is labeled in this. So that way, even the routine work will not hamper. They can easily identify what they want. Yeah, lab permissions can go. So this is what we are trying to do. What is that is accuracy, result, the guaranteed result accuracy. The sample treatment courses, we also have that. And avoid medical risk, abnormal result analysis course, and we have auxiliary diagnostic courses. So these are the courses which we are in Mindray we have for the IVD division. Yeah. Next, please. So lean management, yeah, we all know. Next, please. Next, please. Yeah, we all know that 5 years now we have one thing which they have included, safety. That with that it becomes 6 years. So say now this process will be more related to risk management. That safety is more monitored and process related, quality related. So all these things are maintained to ensure that we are delivering good results for the patient, and whatever feel the patient is getting when they enter the lab. So that is what is more important. He has to feel the peace of mind when he comes into the lab. So that kind of customer support which has to be delivered is what we are trying to achieve by giving this value addition to our customers. Yeah, I think, thank you. I think this is what finally about the lean management, how we communicate, execute these things with through Mindray customers and distributors. You can see this is the layout for the instrument, and then clean identification. We have floor identifications. When you get into the lab, we have a contaminated sticker. Then for where you can walk in, it is called a buffer area, and where the patients can walk in, move in, that is called a clean area. So we have three kind of things which can be seen on the floor. To make more interesting, I have one video of this lab standardization, how we have gone through, and how it looks, because the pictures will give part of the imagination on this. But when you see the video, maybe you will really like it, and I would like to have your feedback, comments. I think we can start the video. Thank you so much.
Yeah, yes, Bala, I'll just start the video. Yeah, yeah.
Yes, with that we can have more. We can have a feedback from our team.
Bala, just let me know if you do not hear the sound. Let me know. I'm just playing the.
Yeah. Audible. Thank you, Nikhil. Dear delegate, this is a small video, so
Yeah, thank you,
hope
Bala.
you like it. Yeah.
Bala, some questions have come for you if you would like to answer. I'll ask the question.
Okay.
I want to ask if there is any separate calibration criteria for standardized laboratory what Mindray provides.
No separate calibration.
Kamal is asking, yeah.
No separate. It's like what we follow in normal laboratory. But we have for each machine, based on the workload. If you take hematology, we have a separate calibration frequency. Similarly, for biochemistry, we have that, and even for immunology, it depends. But the calibration is standard. That we cannot. Why we do calibration is to ensure our values or sample results are going to come properly. After calibration, we have to run quality controls, ensure that. So that when we have to do the calibration is the main question. When we want to do it. So when there is any breakdown or when there is any change in reagents or when they have any problem with related to the machine or with what to say any after the maintenance, they can do all these kind of things with calibration. They can come out.
Okay, I didn't understand the second question. Sir is asking, Dr. Kamal is asking, I found it an audit trail at some of the instrument in standardized laboratory. I don't know audit trial. What does it mean? I don't know.
Maybe what I can understand is for lab standardization, what is the audit we do? Is that question? What all the audit
Yeah,
we do?
something like that. How do you maintain the audit trial or something of that sort? What
Yeah,
is?
yes, okay. So in this first we visit, we try to see how the laboratory is running. We from the beginning of sample collection, we be with them for 1 or 2 days so that how they are doing, what are the practices the individual is making. Yeah, so we focus on each individual in the laboratory. So what if they if they are slightly deviating or doing on their own rather following the norms, then we will try to mention that the correction will be provided and what safety they have to make. So most of the places gloves or coat they will not wear. They don't be little professional. If all these things is not for the laboratory, it is for them. Basically, they need to understand for each individual. This is what the norms. That is the reason we have to be little cautious. Mask, even the head cover, all these things has to be mandatorily followed. So we cannot predict the uncertainty. So it is better the samples has to be handled well. By this process, most of the thing is completely we are reducing the handling of samples. So how short we can make it. So
Okay.
for that we are trying, and we get into all this. Then we discuss this with the pathologist. We'll come out with our findings and what is the action we need to provide. And with this, with the lab management's concurrence, we take up the change in the process because that time is also included. Whatever machines I want to change, it requires their approval, then management support. So with that, we'll be doing all this audit. So that part. After that, we start getting into the materialization. What we do. So we arrange all. If their draw everything is not properly done, then we guide them how it can be maintained. First, we have to follow that 5S, completely remove unwanted things, keep only the wanted ones, and in a proper way. And then we follow the safety. Another case on that. Yeah.
Correct, Bala. Thank you. Thank you. Bala, one more question is
Hmm.
how can Mindray standardized laboratory improve my TAT? How do I audit my TAT? What are the protocols to follow?
At that time, we need to study the process, like from patient entry to patient getting his result. We have to follow each and every process, what time it is, how much time it is taking for a person to complete his job. So once we identify this, then we have to set a process for them, which is the easiest way to approach. For then running the sample or transferring the sample to the department and getting the result, we can see how fast the samples are moving in a right way, because people should not move from one corner to other corner by keeping the machines in different directions. After running it, they should not come. It should be next to next. So when they run it, they easily run the samples in a sequence. so that they reduce the time of their movement. So that is also one thing, one we need to address. And when the reporting is format, and because they should not have confusion when they were while they work, and the ergonomics, well, they said they should not have the tire fatigueness or kind of uncomfort. So these kind of things we need to monitor. So it's a big process which we have to set, and then we have to bring in the right way of working. Then we have to make them practice it. Mindray doesn't stop with this. We also come in a periodic period. So we come down after 3 months or 6 months, see what is happening, whether they have improved. Then we try to give them another direction, or if they are deviating from the standards, then we try to inform the management about the correction pattern. So this TAT process definitely will improve because we maintain the document by searching, or when we want to take any document, how much time it takes, we have to calculate. Then we have to arrange everything in a normal way. Then if you ask our team to take it, when they can take it in a faster, that is the way we can reduce our TAT, getting the things as quick as, because documenting quality reports, taking the reports on time, checking how fast the lab, because once the quality work is done, then only we have to start running samples in the laboratory. So that will make the process easy for them. So we should have one, make the familiarity, bring the familiarity into the team. So that will definitely improve the TAT.
Thank you, Bala. Thank you, Bala. Bala, one more attendee question is, what is the total lab area required for Mindray standardized laboratory? How much sample collection area should we dedicate? So, basically about the specifications. Sorry, asking.
Yeah, see, it really depends on the different factors. One, the workload. How is the workload in that sector? Like for a lab, definitely, even I can say more than 800 square feet is also good enough, or more, it will be better if you have because for the laboratory alone. Maybe if like the clinical lab, if you want to have a different departments, maybe you have to stick on to that norms, where for what machines, how much space is required. So what is your workload? What is the parameters you are going to run? So that defines your volume of equipments which you're going to keep inside the lab. Mainly what I would say is, like, if you have basic parameters, like definitely everyone will be running all the parameters, like like serology, hematology, biochemistry, immunology, urinology. So all these things will be there, microbiology, everything will be in, like, we have to segregate the department, how many equipments we are going to have in each department. So accordingly, the space can be defined. So you can, for a small case, maybe 800 square feet, we can definitely do this kind of arrangement, which looks really good. You can maintain it. Or what I would suggest is, if you want to do anything, even in a small area also, we can practice this standardization. How my lab, even in small labs, maybe say, so I have 400 square feet area. Okay, in that also we can do it. But everything is neatly arranged, proper, giving a proper vent, and we can see how we can do it. Even we can use the vertical space also. So those kind of designs definitely will give results. And for lab standardization, mainly Mindray, we support the customer for when they have the like hemat, bio, and immunology. Maybe if you have plans for going for immunology, maybe equipments, you have only hemat and bio, definitely Mindray can support.
Yeah, Bala, one more product related question. We have Mindray's biochemistry analyzer, which is more than 6 year old.
Okay.
We want to put it in NABL scope. Is it possible? So I think, yeah.
Yeah, obviously it is possible. But when you get into the NABL, we have to clearly have the machine in contract. The maintenance has to be done well, because it is a precision, because the calibration you need to see. Here, the calibration is not related only to the reagents or the controls, whatever we run. It is for the equipment, instrument calibration. That means we have to check the precision of the dispensing of sample probes, reagent probes, washing ability, then lamp intensity, then tubing, internal tubings performance, like what to say, wear and tear parts. We have to inspect. We have to do the replacement. So to do all this, we should have the instrument in contract. We should have PM kit, like based on the age. the maintenance kit also will vary, because internally the tubings will be completely having a fungal growth inside, which requires a replacement. So those things we need to monitor. Whatever recommendations by the company has to be done. So thereby we can definitely have a very good precision. That will be reflecting in your calibration. So when any calibration, if you are doing for glucose, you can check the instrument performance by seeing that when you are doing your next glucose calibration. So if you are doing it after 1 month, that means your instrument is doing well. No need to change, because every day your control is on the same target. So that way you can do. And there are a lot of questions also will come around the Levigenics plot, where it can go, it goes up and down the mean. It is okay. And some biochemistry, it will be almost, for hematology, it will be completely almost in the same line. So need not panic that it might be showing a positive bias or a negative bias, but it's not that. It is okay. That is for the range 1 SD. It falls in 1 SD or 2 SD. That is of concern in hematology. For biochemistry, it will be a different one. It goes around the mean, up and down. Yeah.
Bala, any structural layout for microbiology lab like media preparation and processing rooms?
Currently, I have not handled, but it is we can get it from our headquarters. Like if they have practiced anywhere, because it's a laboratory, definitely we would have even touched the microbiology, because even Mindray has the microbiology equipments, but not promoted in India, but we are in other countries we have. So definitely for that we can support. But it has to, we have to share this information to the respective team members there, like service or sales, they can bring in. Definitely we can support our customers, at least what for the basic needs.
Yeah, one Mr. Abu has a lot of questions related to BA600M. How do I activate the audit trial and things like that? So I think so, Mr. Abu, everything is possible. You can contact us. You can just email us customercare.in@mindray.com. We will be able to help you. Everything is possible. The system you are having is the latest one. Everything, all the features are available. Yes. So there is one more, Bala, I'm not sorry to take you so much time. Please give suggestions to maintain lean management in 24/7 working lab and high workload and large staff in shifts. I think so, sir. Dr. Jay, sir, if you are around, you can also please add on with.
Yeah. When the workload is high, okay. Maybe can I start or?
Yeah. Should I read out again, Bala?
No, I understood. So they wanted how they can maintain the lean management in with a higher workload and big labs. Definitely, we have. First thing is we need to streamline the workflow. What is that mistakes they are making? What is that challenges we are having in big labs? So that has to be identified, because without that, where we have to bring in this safety, because everywhere it will be there will be a safety things that will be done, but making the staff funnel realize that this is why we are bringing this, so that education should come when they have, because when they have a very high workload, they will definitely miss certain things. So their movements also should be restricted. Like that means the workflow, the instrument arrangement should be very well done, and there should be a good amount of space for them to move, not a congested area, because the workload is high. They cannot go around. They cannot have a big circle and then reach out other machines or get the results. So everything should be reachable for them. So we have to find a solution. Maybe they can have a island table in the center of the lab, so that everybody can reach out for documents or keeping the documents or referring the documents. That way it can be useful for them. But it's a lot of design based on the area what they have, and the practices what is done, and we can add on the safety measures to them according to the scenarios is going on. So, but definitely, as told, we have to clearly understand study the process, how things are moving, how, like what is the way of movement that we have to see. Sample deliveries also. So then even congestion. In this areas we should not entertain patients or more team members into that work area. So we have to restrict those kind of uh, workflow. So it should be moved in a very isolated way. So that way we can restrict the people moving. So that way we can have a little bit of improved that.
One is asking in Mindray standardized laboratory, standard or quality, what is emphasized? Standards or quality?
See, first, we can get the quality through standards. So definitely, we are working on the accuracy standards. That is the main thing. That is the quality for how we want to do it. When we want a quality job, we should have a proper process to follow it, and we have to monitor it. It's like a PDCA. We have to plan, to check, and analyze again, act and. So this is a continuous process, servo process. So definitely, we focus on quality and work for the standards and maintain the standards. Because our reports, main thing I told you in this forum, that quality reports accuracy is what going to develop the reputation for the lab. So definitely how to do it is what we are bringing the standards.
Yeah. So some more product related query. Are there any dry chemistry analyzers from Mindray? So we are into wet chemistry only. So we have a range of wet chemistry, right? From semi-auto to 100 throughput to up to 2000 throughput. So yeah, you can visit our website. Of course, somebody is asking about franchisee and rental instruments in the standardized laboratory. So, Bala, something on that sort, franchise, I don't think so. Means, of course, it's through our channel team.
Yeah, definitely RR reagent rental can be implemented, but it will be routed through channels. Definitely Mindray will support for that kind of process, like kind of agreements. But the workload should be relevant. There are a lot of terms in the RRC business. Definitely, it can be done. If a good workload is there, definite openings. They can reach the appropriate sales team.
So one question, I don't know if Jayesh sir is around, maybe Bala, you can also help. Accreditation by which of the below is superior or better? So I don't know this because he's asking one is Joint Commission, International, JCI, NABH or NQAS, government hospitals, any other. Jayesh sir, if you are around, maybe you will be the best person. You're the
yeah. Actually, I saw that question. So basically, with respect to the accreditations and certification, which is best? So very difficult to define. So maybe I can advise you. You see whatever requirements are relevant to your work, or maybe what is your purpose of getting the accreditation. Like some people wants to get insurance clients, some people wants to get international clients or patients. So if you need international patient, obviously you will need a JCI accreditation. If you want to just get panel on some insurance companies or ECF, ESICs or some government schemes, so NABH will be sufficient. Or if you are having a small laboratories, you can have a NABL accreditation. If you are in a government setup, NQAS certification is also there. So basically, everybody has their pros and cons. So you have to see what are your requirements, what you need, why you want, basically why you want accreditation. It is just you want to show some logos somewhere that you are accredited, or is there any specific purpose, if there any specific intent. So considering the specific intent, you can choose any accreditation bodies. For me, all accreditation bodies are good. They have their own protocols, they have their certifications, they have their certification criteria which are all standardized. So it is not like that something which is in NABH or NQAS is something local, and JCI which is something international and is something high-fi. See whatever are your requirements. Even because if you go something accreditations like JCI or CAP, so you have to see the financial constraint also. So you should be making that much money to spend accredit on that much on accreditation. So quality doesn't mean that you should have an accreditation. It can be without your accreditations, or it can be without your certifications also. It is just something, a third party certification which is mentioning that you are accredited or you are certified. So depending upon your needs, I can say that you can opt for any of the accreditations and certifications.
Yes, doctor. Because when customer looks at the laboratory tab, they see whether this NABL or ISO certified. So they see those kind of certifications. Second thing, when you go for research, they ask before they define the laboratory or establish a laboratory. They ask these are the certificates they should hold so that the testers can be run. So there are needs, as doctor said, depending on the need and our capability of participating, because this certification will definitely involve a lot of time and expenses also, because we have to do calibrator, we have to buy calibrators, we have to have all the equipments in CMC, we have to see the maintenance controls to be run daily, we have to see that, we have to document it. So that that if we are really prepared and think, definitely all are really good level of certifications, certification body.
Dr. Jay sir, one more question for you. What should we do if we do not have reference material for linearity measures? Bala, maybe if you can.
So basically, if you do not have a reference materials for linearity measurement, you can use calibrators which are provided by the manufacturer. Apart from that, the best material is the patient sample for confirming the linearity or performing the experiments of linearity. The best material is the patient sample with a very high values or which are nearer to the linearity. If you do not have those high values, then you can opt for the reference material. If you do not have reference material, calibrator is available everywhere. So you will have calibrators. You can use those system calibrators also to check your linearities. So we have a couple of options. Those options you can try anything whichever is feasible and whichever is relevant for your laboratory. The purpose again, I will like emphasis again once again. Your intent is to check the linearity. There are these all these 3-4 materials which I have mentioned. These all are recommended and acceptable. You can use whichever is available and whichever is feasible to you.
Sir, thank you. Sir, one last question for you. We are already running behind. One person asking, sir, how do I get the calibration and traceability of my pipettes, centrifuge, incubators, and things like that?
So basically, there are various agencies. There are calibration laboratories. Number of there. You just Google, or you can go to some even the NABL website. You will get a list of agencies which are accredited for calibrating your pipettes and centrifuges. You can choose any one of them, because if they are accredited, that means they are up to the quality standard as per ISO 17025. You can choose any one of which is nearer to your location of your laboratory, or whichever is accessible to you, which will match best with your financial constraint. So you can choose any one of that. The only major important thing, you have to see that the laboratory from where you are getting calibrated your equipments and pipettes, the laboratory must be accredited as per ISO 17025. So that is the only one criteria we have to follow while selecting the calibration laboratories.
Okay, sir. Thank you. And sir, how to get CLIA and QMS documents?
So again, as I mentioned, I have answered it already that you have to just Google it. CLIA 2024. You will get the PDF downloaded in your computer. So it's not very hard. Just Google it. It's available freely on website.
Thank you, sir. Thank you. And Bala, one question for you: biochemistry analyzer, when it should be calibrated, what is the frequency, and it can be done only by the service engineer or by the laboratory person also?
For biochemistry analyzer, first we have to do the maintenance. We suggest every 4 months once we have to do the maintenance. If the workload is high, then we can do 3 months once we have to do the maintenance for the equipment. When we have to do the calibration, definitely when any part is replaced, any problem with the dispensing, or when they run controls, everything is going negative bias. So those kind of indicators, when they find it in their parameters, for all the parameters is getting low, or the dispensing is an issue, that is dripping. So after the services, they have to do the calibration. And frequencies in a year, we need to do calibration. Okay, this not only or what I say, it's not just checking the doing the calibration for the reagent parameter, it is for the equipment. So per year, we have to definitely do instrument calibration, where we have to check the voltages of the power supply, where we have to check the voltages of the outputs, which we are for the sensors. Why? And the second thing is the probes. Probes, we have to see, we will be doing precision check. Precision check can be done with a known absorbance, that we'll be running potassium dichromate, traceable material which is available. With that, we will run that as a sample, and reagent as a water, and similarly we'll change it. So when we want to check the reagent probe, we will use instead of reagent, we use potassium dichromate, and then we use distilled water. That way we can see the precision. This precision will confirm us the complete optics, complete dispensing, syringes, complete tubing, valves operation, everything will be confirmed by this precision check. We run 20 times and check the value of it. So this gives us a clear idea of the instrument. And then electronic part, we need to check the sensors, voltage, everything. Why we want to do this sensors? Because if instruments we have a connectors from electronic boards, we have a lot of motherboards connected to the power supply, where you can find these connectors are getting oxidized. Though it is gold plated, there may be slightly maybe if it is not good one, maybe it will be a light of citric acid developed there. So those kind of things is going to develop resistance, and there will be a voltage drop. Definitely, if a processor requires 5 volt, this kind of drop will reduce slowly over a period. It can drop over 1.5 volt. So your system will not give good results. They'll be wondering, everything is new, reagents are new, but still my results is fluctuating. That is fluctuating because processor is not able to identify it as 1 or 0. So because this is going, if it is above 4.25 or 5, it will decide as 1. So digital things, if it is going near 3.8 or 4, it is going to consider as, it will toggle. It will become like a equivocal. It can't even identify whether it is 0 or 1. So that time calculations will be mismatched. So this is one thing we have to find out, that there we require the calibration, and more how we can protect the instrument. Daily cleaning and maintaining of the instrument from the user side is mandatory. They cannot leave it like that. They have to wash the well, wash the wash station, keep the equipment clean so that dust particles are not leaving, and you have to remove the reagents after use and keep it in the refrigerator. That thereby you can reduce the day routine calibrations, repeatability, like a period. So that is one thing you can definitely bring in. And second thing is like when you keep this calibration, this certifications, everything should be done by trace with the calibrated equipments, calibrated multimeter, calibrated temperature sensors, then calibrated tachometers for the speed. These are the things that we have to check, and then we have to attach the document for this instrument calibration with all the parameters. So with this, we have to submit it to NABL. Definitely this will get approved. So at least yearly once you have to have this instrument calibration apart from our routine calibration.
Bala, sorry, one last question.
No,
For Mindray standardized laboratory, do you have a standard template or a model, or is it custom made for every laboratory?
It is definitely a custom made one, because we can define a lab that, okay, you all like we can say that we can suggest, recommend to keep these machines in the laboratory, but it all depends on the capital of the laboratory, right? Like whether they can able to purchase that machine. What I suggest is maybe for standardized lab, it should be like a medium sized lab, not a small lab, because it will be more useful. Even in small labs, you can have a small what to say, like you can define well that you can organize it and keep it. Bigger labs, why we are doing it is because the area is big, the flow of movement is big. So in those cases, we are trying to define a little bit of awareness to the people who are walking in and coming out. So that is one thing. If it is small lab, only one person will be working, so he knows what he is doing. Where if he maintains well, it is easy to do it by a small group. When it's going a big group, then Mindray involvement is coming in. So for medium size, what is required is for each department, do we have the equipment? Like for Mindray to do it, Mindray recommends that they should have BC 5000 5-part, then one BC BS 240 as a basic model, and then one Playa. If this is there, maybe Mindray will definitely suggest, help them in doing that.
Thank you, Bala. So I think so that's all, sir. And Bala, thank you so much for today's session. We had an extended session today.
No problem. I'm really happy that
No, there are in fact a lot of more questions, but there since they are repeated, so who check controls when so many things calibrator available for. So more of repeated questions which you have already answered. So I'm not taking that since it is already 8:40. So I think so. Thank you very much, sir. Tomorrow again we'll see you at 7 p.m. for the final session. Some basic queries like when will the post assessment questions be available. So everything will be available tomorrow. Certificates will be available tomorrow. So please do join us tomorrow at 7 p.m. Thank you very much, Dr. Jayesh, sir. Thank you very much, Bala.
Yes, yes. Thank you. Thank you.
Thank you. Thank you, doctor.
Thank you.
Thank you. Bye. Okay, Bala. Thank you. If you Bala, if you want to reply to so many questions related to like controls or something, you are free. You can type or you can also talk because we have just sir is now left. So like what is if you just check the Q&A box, na. So
You can go through now because you have followed the section.
Yes,
Anything
yes,
that
yes,
missed
yes,
out, I
yes.
will just repeat.
So I'll just because is any calibrator of course is there any calibrator available for hematology analyzer? Yes, the manufacturer gives the calibrator for every hematology analyzer. Who checks the controls? So I don't know what
controls actually our lab staff should check the control because it is run on a daily basis.
Yes.
Because when we release a result, any sample from the lab is released only after we check the instrument performance, how it is working, whether it is uh, right time to release the result. So morning hours we have to run the sample the controls. Check. We have to run 3 controls. If you have a very high workload, definitely you have to run 3 controls: low, high, and medium. All the results when correlates, when falls in range, then you can start running the samples. If not, then you have to see that where we are going wrong, any cleaning has to be done or any calibration need to be done. We have to find it out. Maybe for biochemistry, we have this kind of problems for few parameters. Maybe if you replace the reagent, it will be okay. Or if you replace the calibration, if you do the calibration, it might be okay. So those kind of things will be there. Hematology, it is mandatory, and even hematology, if the sample workload is more than 100, maybe in the afternoon, twice or thrice also we can run the controls, morning, afternoon, and evening, if you are running 24 hours.
Yeah, Bala. Then one more question related to your explanation earlier. What is the concentration of potassium dichromate? Is this to be run in a sample mode or in service mode?
No, actually, this is we have a procedure. I just mentioned the content, but it is 0.32 gram we take actually. But you should have a traceability of that. Maybe this potassium dichromate with 8 absorbance. That means normally when analyzers can read only 3 absorbance, but this material is 8 absorbance, which is available in Merck. So with Merck, they have this one. Maybe we can try. But you're on mute.
Sorry. One more question. If my controls is -2 SD, is it acceptable for me to release the report?
See, if when definitely it is releasable, but you have to see instrument when you enable the Westgard rules. Definitely, instrument will automatically monitor all the levels, whether it is 1 SD or 2 SD. It keeps monitoring. For 2 SD, only 2 times it will allow. Third time, if any value comes on the 2 SD, that is on the third day. First day you run, it is on 2 SD. Second day on 2 SD. Third day, if you run on 2 SD, it will give alert. It will say it will not allow you to run samples if you trigger the Westgard rule. So what you have to do, you have to do a calibration, bring it to the mean value, then you have to then you can start running the samples. Otherwise, it will not allow. If Westgard rule is activated, then it will be a bit challenging because it will not run samples. So it is better you manually check and then you can you can do the calibration and again recheck for that particular parameter and then you can run samples.
Yeah, one more repeated question. Yeah, is the pathologist or technician is responsible for controls going out? I think so. It's a dual responsibility.
No, however, pathologists cannot be responsible because staff who is maintaining the sample, how he is using the controls, not samples, controls. If he is using in a proper way, like capping it up, or when the mixing is happening, they open it up and do it. Sometimes the bloods around it will not be wiped out well. They keep running it. Maybe the debris falls into it. And maybe when you run this these controls in when I'm talking about hematology, when you run it, if there is a drip in the instrument, anyway there will be a small drop. When unseen, if falls into it, also will create a problem. It will dilute it. So what we say is control stability will be only 15 days, maximum 17 days once you open it. So are we following this? We need to check it. And second thing, when you do for biochemistry, when you do prepare a calibrator or control, it is only it is a lyophilized and be aliquated. So aliquation is done not by the not done by any biochemist or for him it is not a pathologist. But for biochemistry, only our lab technician should be responsible for biochemistry part. Hematology part, definitely pathologist is nowhere. Pathologist will verify whether controls falls in range, and then they will sign the report, sample reports. Otherwise, they will not sign the report because controls have not fallen in place. So this is the primary question. Hope I answered this one.
Yes, yes, Bala. Thank you. So it's of course, yeah, it's more of supervision for the pathologist, and yes, the process.
Yes, exactly. They will be checking the reports day to day whether the controls, all the controls for the equipments, all the controls are in range or not. Then only they will start accepting the results coming from the machines. Yeah.
Bala, one more question. What is the criteria for hematology lab technician if he have only microbiology lab experience? Then what should we do for training?
So first we have to that is very depends on the management because if we see that it's a hematology and microbiology, I think that they can learn the subject very easily. That only the day-to-day routine they can maybe initial training phase they can have a plan for 3 months, how they have learned whatever they have learned. They have to observe them whether they have practiced it. I don't think that it will be a difficulty if microbiologist handling thing, but we have to see that whether he can spend quality time in microbiology because it is his prime thing. If he is going to get used for microbiology, then he will not find time in hematology. If we are going to use him as a hematologist in the hematology department, yeah, it depends on the learning ability of that individual. Definitely, it can be done because lab technicians are making even from DMLT. They do they handle the hematology equipment. Definitely, they can do slides, everything they can be taught to them. Definitely, like they will have the microbiologists should have that ability to learn. Definitely, it is possible. Depends
Uh,
on how they are using.
Correct, correct. So, Bala, last question. Calibration material. What is the refrigeration required after refrigeration? What is the shelf life? Can we reuse? Thermometer calibration should be done inbuilt or external. So there are so many questions related to calibration material.
Yeah,
So
calibration materials, when you talk about hematology, it should be maintained between uh, 15 to 25 degrees, not more than that or less than that. So it is better if you keep it in a refrigerator. No need to keep it in the deep freezer or freezer. No need to keep it in that because that will lyophilize the material. So you have to be very cautious. It has to be kept in that temperature. It will be maintained. On and off opening can be avoided so that nowadays piercing models are coming. Maybe you can use the piercing model for hematology. Thereby you reduce sample handling. So that is the reason we go for piercing models. We have normal models as well as piercing model. You can choose piercing model for hematology if the workload is high. So automation will definitely reduce sample handling. This is for hematology. When you come for biochemistry, definitely your samples can be refrigerated. So yes, deep freeze, not a problem. But only thing, how you allocate your calibrators control is really important because they prefer that when you calibrate, when you allocate your calibrators, it should not be mixed. It should be gently rotated on a flat surface for the mixing, and you have to keep it in a dark area where light is not uh, falling over it. This is because there are enzymes which can be broken. So usually we have OTPT and all those kind of parameters which will get affected firstly. So this is very sensitive. So enzymes related parameters will be broken if you keep agitating. So it has to be slightly gently done. Even for control hematology, we have to be very cautious. This kind of sample handling is the major role when it comes to pre-analytical errors. So when we collect the sample, when we handle the samples, so this will play a major role. So same kind of handling should be there for controls and calibrators. So that is more
Correct.
important.
So one is asking hematology, control, open viability, how many days? So it all depends on the manufacturer, right? Different
Yeah,
manufacturers.
usually it is 15 days. Hematology, it is 15 days. And
Okay.
for biochemistry, if you are allocating in your bullet tubes, then it is not a problem because you can use only the bullet tubes for the checking. Rest will be it will be in a freeze condition. No need to thaw and then freeze. No need to do on and off. So
Okay.
this will hamper the parameter values. You will not get. So sometimes when you dilute the calibrators controls, you have to, when for lyophilized ones, you have to be bit careful. Properly inject that every drop of it, so that 3 ml means 3 ml, 2 ml means 2 ml, 1 ml means 1 ml. Read that vial product insert well and then prepare it. Move stepwise. Follow the steps. Definitely, we have to take more precautions. If you use the pipette, first see that your pipettes are calibrated well. This is another important thing which if not followed, definitely your calibrator values are going to be diverted. Because if you are going to dispense one instead of 1 ml, if you are going to dispense 1.2, definitely your values are going to get little bit lower side. So this is, and then similarly for 1 ml, if you reduce diluting it 800 ml, it is going to get little bit higher. Then we will scratch our head where the things going wrong. It's a new vial. So
Correct.
our pipette should be very like calibrated ones. So every tools, equipments what we use should be calibrated. That is the reason this gives the quality results. So quality result is our goal. So we have to maintain the proper process and standards for the lab and the technicians or staff.
Thank you. Thank you so much, Bala. Thank you so much for the session today. Thank you very much for explaining us what is Mindray Standardized Lab. How can our customers approach us? What are the criteria and definitely, and how can we help them? And of course, thank you for your extended support in, the technical questions. Of course, there are so many other coming, but let's stop it now. Let's
Okay.
maybe continue for tomorrow. Thank you very much and good night, everyone. Thank you very much for joining. We have requested you for your feedback. There is a link in the chat box. I will again send it. So just a minute of yours, if you can just share your feedback, it will be very helpful for us. The sessions and what would you like to learn in the upcoming sessions and things like that. So yeah, thank you so much all. Thank you. Good night, everyone. Thank you, Bala. Thank you for joining.
Yeah,
Hope to
thank
see you
you.
tomorrow also if time permits.
Yeah,
Okay.
sure, definitely. We'll be in touch. Thank you all. Thank you.
Bye.
Bye-bye.